Hello, this is Dr. Emre Karadeniz, hair transplant surgeon from AEK Hair Clinic, Turkey. I'm going to talk about hair loss medication. These are medications that are used to prevent or reduce male pattern hair loss. Finasteride, which is used as an oral tablet, and minoxidil, which are used as a spray or foam applied topically. I hear many questions, comments, or requests like, I don't want to use hair loss medication. Do I have to use hair loss medication to have a hair transplant? Or I'm looking for a surgeon who doesn't recommend as a necessity taking medication. Now, there's a few things you need to understand. One, if you want to fight hair loss, okay, you have two main weapons. One is medication, which actually reduces hair loss and helps stabilizing hair loss. And the other is having a hair transplant. But you have to understand, having a hair transplant doesn't do anything to reduce your hair loss. So in reality, having hair transplants isn't the treatment for hair loss. It is to replace lost hairs. It is actually to redistribute what's remaining. In order to stop hair loss or reduce hair loss, you have to use medicine. That means that if you're going to fight hair loss, you have to use these two weapons at the same time. Use medicine to reduce hair loss and have hair transplants to fix the problem that has already occurred. If you don't take medicine, what's going to happen is that your hair loss is going to progress. Especially if you have a rapid hair loss starting from a young age, chances are that your hair loss will aggressively continue, and that even if you have hair transplants, because your hair loss will continue, what's done during that hair transplant will be partially or significantly destroyed, which means you will have more hair transplants sooner. And since the donor capacity on one scalp is limited, you have to worry about running out of donor hairs and being helpless against the progressive hair loss. So from that, you have to understand that fighting hair loss cannot be managed without using medicine. Now, this is a fact. On the other hand, for a hair transplant to be successful, you don't need to take medicine. Because the success of a hair transplant means if you transfer new hairs and these grafts take, which means they grow where they're supposed to grow naturally, it means the hair transplant is successful. For that, you don't need the help of medicine. These grafts are going to survive if they're going to survive, and they don't need any help of medicine. So medicine is not a requirement for the success of a hair transplant, but it's a requirement to protect against future hair loss. Or you can say it's a requirement to keep good hair. Let's not forget, keeping good hair requires, of course, stopping hair loss and replacing the lost parts with a hair transplant. So to keep good hair, you need the combination of these two. So when a doctor recommends you medicine, he's just telling information about current science. And most of the times the doctor is not selling these products. So the doctor is not going to make money by recommending you medicine. So it's for your benefit. So, when I hear patients saying, oh, I'm looking for a doctor who doesn't recommend medicine, or sometimes patients mistakenly think, oh, look, this doctor is recommending medicine, so he must be not trusting his work. Or they think, oh, this doctor says you can have a hair transplant, I don't recommend any medicine, you can do without taking it. Oh, this doctor must be so good that he doesn't need the help of medicine. But this is actually not true. So the reality is that the doctor that is recommending you medicine is doing it for your benefit, not to his benefit, because the hair transplant is going to work regardless of you using this medicine or not. But you'll have problems in the future. The doctor that does not recommend you medicine is actually doing a kind of malpractice. He's misinforming you. He's not telling you the importance of medicine in keeping good hair in the long run. So he's taking advantage of these people who want to not use chemicals. Now that's understandable. You don't want to use chemicals, but my explanation to this is male pattern hair loss is a natural process. It's not a disease. It's because we are men. So when we don't want to have hair loss, it means we want something against nature. If we want something against nature, we must always pay a price. And the price for that is taking chemicals. So they ask sometimes, do medicine have side effects? There are the chances of side effects, but it's a trade-off. Either you surrender to your hair loss or you risk side effects. Now, small note about side effects is that when patients ask me, are there side effects? Now, you have to break down that question into two. One is, are you asking what may happen 1 out of 100 or 1 out of 1,000? Or are you asking what generally happens to most of the people? Because if you are looking for every possible side effect, if you just look into the simplest painkiller tablet, you'll see a list of huge side effects, and some of them are life-threatening. But these don't happen, perhaps 1 in a million. So we still take those painkillers because the chances are so low. So I'm saying that because side effects in these medicine are pretty rare and they're not, threatening your health. And more importantly, when they do occur, they disappear when you discontinue the medicine. So let's say 99% of the time you don't have any side effects, so it's, it protects your hair. 1% of the time you'll have some side effects and you may have to discontinue, and then you don't have side effects. So does that not sound like it's worth a try? It sounds to me like it does. So it's up to every individual to decide whether you want to use medicine or not, but you have to understand what this really is about. You have to understand to fight hair loss, you need the combination of the two. Or just hair transplants will not take you to the very end. You have that until your donor supplies are finished and then you'll surrender. So they work together. And doctors recommending medicine are not doing this because they want to make money, or they're not doing this because they don't trust their work. Our doctors who say, oh, we don't recommend medicine, they're not doing a good thing. So I hope this short video about hair loss medicine gives you some insight into this topic. Thank you for watching this, and I hope to see you in the next educational video. Goodbye for now.